Thank you. As you're likely aware, deficits in imitation ability in individuals with autism are commonly seen, and these lack of imitation skills extends beyond not being able to clap or wave on command, but may actually underlie more complex skills such as social understanding, empathy, language, and joint attention. So because of this, obviously understanding what underlies imitative deficits in this population is important, not only in our understanding of the disorder itself, but in looking at treatments. Mu frequency is the oscillatory activity measured between 8 and 13 hertz from the motor cortices and is believed to underlie imitation ability. At present, there's some debate in the literature as to whether or not mu frequency desynchronizes during observation and execution of motor actions in the autistic population, as it does in typically functioning individuals. And our study aimed to contribute to this debate, broadly to look at whether or not we could find differences in desynchronization between the individuals with autism and individuals without autism. But more specifically, we wanted to look at whether teaching children to imitate who had autism through intensive behavioural therapy influenced the underlying physiology, or the physiology that may underlie imitation ability. We had 3 groups of children in our study, aged between 2.5 and 7 years. The first group had a diagnosis of autism and had had at least 15 hours per week of ABA therapy for at least a month. By nature, imitation is targeted in a number of drills in this therapy. Our second group had a diagnosis of autism but had undergone no behavioural therapy, so had not been specifically taught to imitate on command. And our third group was typically functioning controls. All groups were matched in age and gender, and the groups with autism were matched in autism severity and verbal ability. Each child was assessed first on verbal ability, and 2 compliance tasks were undertaken to ensure that they understood our instructions and also to check that attention was not an issue. And then we did about a 20-minute imitation task that was videotaped, during which time EEG recordings were taken from positions C3, C4 and FZ. The imitation task measured actions that were meaningful, actions that were non-meaningful, gestures and actions upon a substituted object, and accuracy and error scores were taken from this task. However, I'll just discuss accuracy scores today due to time. So on this side you see the imitation performance, the accuracy scores for the 3 groups, and you can see that the control children were more accurate in their ability to imitate across all categories than were the children with autism. However, there was a significant difference in the accuracy between the children with autism who had undergone treatment and those who had not. So we basically showed that with the behavioural therapy, imitation ability had improved. But whether or not this influenced the underlying physiology was the next question. The graph on the far side shows us mu frequency at baseline, during observation of action and during execution of action. And you can see that the control children showed desynchronization of mu frequency during observation and execution. Both groups of children with autism did show some desynchronization during observation and execution. However, this was to a much lesser extent than the control children. So we showed that there was less desynchronization in individuals with autism than there were typically functioning controls during execution and observation of action. Interestingly, improving imitation ability through intensive behavioural therapy wasn't reflected in the physiology that is thought to underlie imitation ability, because both groups of children with autism showed restricted desynchronization during observation compared to controls. This may indicate that there is still a dysfunctional execution observation matching system in individuals with autism, despite intervention teaching them how to do basic imitation skills reliably. And this may account for why deficits in social empathy, joint attention, social understanding, and things that we believe are linked to imitation ability still exist despite acquisition of baseline imitation skills. Thank you.